Hello and welcome to Health Affairs This Week. I'm your host, Jeff Byers. We're recording on February 19th, 2025. It's snowing here in Richmond, Virginia. We'll see how long that lasts before this winter keeps on giving. Before we begin, I want to point listeners to the fact that we released a new Ahead of Print article for the March 2025 issue on demographic variation in U.S. outpatient drug use, such as ivermectin, during the COVID-19 pandemic. And also a quick heads up, on March 12th, we are going to do a live taping for A Health Podyssey with your host, Rob Lott, on March 12th. Rob will chat with Yashaswini Singh on her upcoming paper in the March issue of Health Affairs. Again, that's on March 12th. And the paper is on private equity's effect in healthcare. And, you know, when it snows, it pours. And here to discuss private equity in healthcare, I'm joined by Kathleen Haddad. Kathleen, welcome back.
Hi, Jeff. Nice to be here.
Yeah, thanks for joining. Yeah, as I mentioned, when it snows, it pours. So there's been a lot about private equity in the healthcare space for a very long time, not just this week or the past couple of months. And I don't know about you, but when you hear something or when a lot of people are talking about the same thing in different formats, you can get sources a little jumbled up. Does that ever happen to you?
Oh, yeah. And looking at the reports we're planning to talk about today, there's so much good stuff in each of them, and then I forget which one said what. But since they both say similar things, I'm not sure that matters too much.
Yeah. So we today are going to talk about two reports that came out around the same time from each other, maybe a week from each other, that looked into the role of private equity in healthcare space. So when we decided we were going to do this episode on these reports, I actually thought there was only one report. And then as I was diving into the details, turns out there is not one, but two. And I'm sure there's more reports on this elsewhere. But we're going to be talking about, one was a bipartisan staff report, and another was a report in response to a request for information on consolidation in healthcare. Both were released in January 2025. And according to our notes, they were released within a week from each other, which is kind of confusing. And so let's look at the HHS report first, which culminates a year-long investigation and reviewed more than 2,000 comments. Kathleen, what's the top line here?
So this report was issued by HHS and also DOJ and the Federal Trade Commission. The purpose was to inform actions these agencies could take to improve competition in healthcare. So it's good to know that a slew of research now has shown that private equity-owned practices, hospitals, nursing homes, et cetera, charge more, offer lower quality of care, and limit access. And so this report summarized and categorized thousands of comments that they received, focusing on the trends and some solutions that might be considered in the future.
Yeah, and just to note, we're talking about private equity, but also there is that kind of dovetail topic of consolidation in healthcare. So interesting to note that private equity owned practices and hospitals were flagged in this. So the report noted 5 major themes. Can quickly you go over what those are for our listeners?
Sure, Jeff. The issue with private equity is that seems to be the major driver, the major investor, and that ends up consolidating healthcare. In addition to hospitals in the past, hospitals had been buying practices, and but right now the focus of these reports is mostly on private equity generated consolidation. So the themes. Quickly, 1, consolidation leads to higher prices and less access for patients, lower quality. Third theme, it changes the work environment for providers, and physicians have some mixed reactions about that. Fourth theme was that PE transactions are shrouded in darkness, sort of like when the Baltimore Colts moved to Indianapolis in the dead of night, if anyone remembers that. People don't like...
But the band played on.
People don't like health insurers is the 5th theme. That's not news, but that applies especially, the report said, to vertically integrated insurers such as United Healthcare would be an example. They own the insurance component, and then they buy providers and they earn money based on both the coverage and healthcare decisions. So that's a new phenomenon that was mentioned.
Yeah, and I don't think these themes should be much surprise to people that follow this topic within a scholarly journal. I know Health Affairs has published a fair amount of papers on private equity and its influence on the healthcare costs and utilization. So what is it about private equity-owned healthcare that causes this?
So PE firms, as you know, buy practices, but they also buy practice management firms. They buy emergency department physician groups, anesthesia physician groups, hospitals, nursing homes, the operating companies that operate hospital and nursing homes, and the real estate investment trusts that buy the property upon which hospitals and nursing homes sit. And they do this so that they can evade, it's a bit of a pejorative term, but so they can get best tax benefit by kind of separating all these pieces from the actual hospital entity or nursing home entity. And so what happens is when a PE provider comes in the case of a provider practice, it's a little simpler. They will cut the costs. They'll buy one practice, let's say a dermatology practice in a market, cut costs there by using lower credentialed staff, LPNs instead of registered nurses, for example, PAs instead of doctors, take out debt based on the asset they just acquired to buy other practices in the market. So the practice is saddled with debt, or hospital, or in the case it may be. And then they sell the consolidated practice. They buy up all these other practices. They control the market rate, prices rise, and then they usually sell that in 4 to 7 years and go on to the next venture. So it's easy to see how practices can charge higher prices and offer the most profitable services and drop less profitable services. I think one example is really helpful. In the agency report under the quality theme, the American College of Emergency Physicians shared results from a questionnaire of its members, and 53% of those emergency docs said their medical decision-making autonomy was curtailed following the merger or acquisition. There was pressure to take shortcuts and give inappropriate and potentially harmful care, in quotes, and they were guided to meet profit-driven metrics, and said patients, quote, are treated as numbers rather than individuals, and that care is no longer patient-centered but metric-centered. The same survey said that these ED physicians saw wage reductions of 20%.
So the theme that provider consolidation leads to higher prices and less access for patients also showed up in the other report commissioned by Rhode Island Senator Sheldon Whitehouse and also Chuck Grassley, who is in a state I'm not, don't have off the top of my head in the Senate.
I think it's Iowa.
Iowa. Okay, I was going to go with Arizona, but so I'm glad I didn't bet on that. I lived in Rhode Island for 4 years, so I got to give it up to Sheldon.
Yep.
What was the top line of that report, though?
Well, that was interesting. I think an important thing about Chuck Grassley is he's a Republican, and this is a bipartisan report. So that's useful. The report dug up the financial and operating records from two prominent PE firms, Leonard Green Partners out of Los Angeles and Apollo, which is the largest owner of rural hospitals in the U.S. The report found that PE ownership led to understaffing, unsafe building conditions, hospital closures, declining quality, and unsustainable debt.
You mentioned the lack of transparency was a theme. What do you mean?
Yeah, that was one of the themes. PE-acquired healthcare providers are divided into all these various entities, and the ownership structures are very complex. There aren't too many laws or regulations that require these people or these owners or these companies, entities with equity stakes in any of these companies to be made public. So not only do patients not know who owns their physicians, but many of the physicians and clinicians don't know who they work for. I remember one time going to my internist and asking him, who owns this practice anyway? and he was a little cagey and said, well, we did use an investment firm and they owned something for a while, and then we did something else. And to this day, I don't know who owns it.
They didn't send it put it on the bill?
No. There are different names on the bills.
Yeah. Okay, so what can be done about this?
So both reports land on similar solutions. These include greater transparency of ownership, lowering the dollar threshold of the value of acquisitions that have to be reported to the FTC, and forbidding non-compete clauses in provider contracts with their owners. The agency report recommended adoption of a rule that's similar to the one adopted last year for nursing homes, and that rule requires nursing homes to report all owners to CMS and be made public. The reasoning is that this allows regulators, not only regulators, to hold PE owners accountable, but allows the public to choose providers based on ownership and even related criteria such as staffing ratios and adverse incidents, if these were included in a public-facing report. And there is advocacy for that as well.
So what's the likelihood of any solutions being adopted in the current political environment?
Well, Jeff, that's a good question. One of the reports contained a link to President Biden's anti-competition policy that he issued in 2023. So when I went to the link, I found 404, a page not found.
Yeah, well, do you want to know some breaking news
Yes.
that will be stale by the time this publishes?
Yes, go for it.
I got a report from Healthcare Dive that FTC, this is the headline, FTC retains stricter merger guidelines under Trump, with lead-up text saying FTC Chair Andrew Ferguson sent a memo to agency staff on Tuesday clarifying that the Biden-era guidelines will remain in place for now in a setback for healthcare mergers. Becca Piper wrote that, who I think she's going to join us in a couple of weeks, so please don't sue me. And I have not read the rest of the article.
Well, that's interesting news, Jeff. There soon will be a Trump-appointed majority on that commission, but if the chair is stating this and stays with this policy, that's good news for competition in healthcare. Another piece of good news is that the state's attorneys general have authority to regulate mergers and acquisitions as well, and some are doing so. States are passing laws to empower broader regulation of M&A activity as well.
Yeah, it will be interesting to see, because I think that was this antitrust guy. I think there was a big question mark from what I gather of people wondering what kind of line the new Trump administration will take. So it's an interesting signpost of what potentially could come. But then, you actually still have to go through the, blocking mergers and acquisitions kind of activity. So we'll see what happens.
Right, and they have to have enough staff to do the reviews. I think right now the dollar threshold for reviews is $125 million, the value of an acquisition, and that's that. When it gets to that level, they have to be reported to the FTC. But we'll see. We'll see.
Yeah, we'll see. Well, nice to have some news to dovetail with this, in the addition to breaking down the two reports. I think we mentioned off mic. You mentioned one of the reports is like a pretty nice qualitative study. Is that right?
Yeah. It was not. It was easy to read. It's the agency report.
All right. Well, we're not playing favorites. We'll put both in the show notes, and you, the listener, can check those out. Kathleen, thanks for joining us today on Health Affairs This Week.
Yeah, that's what we are. And I'm glad to have been with you, Jeff.
Yeah. And to you, the listener, thanks for listening. If you enjoyed the show, please leave a review. It helps people find the show, and we want to continue making the show for you. So anything that you can do to help people find the show would be great. For instance, send it to the regulator in your life and or the venture capitalist. Either one would do. Venture capitalist. Send it to the venture capitalist. And with that, we'll see you next week.